Hello everyone! Today we will continue to talk about degeneration, one of the tissue responses to injuries. Let's begin with a case. A 54-year-old man with a long history of alcohol abuse was brought to the hospital semi-comatose after an alcoholic binge. Shortly after arriving at the hospital, the patient died. Here, we have the autopsy findings. This slide shows the appearance of the liver. This liver is enlarged and heavier than a normal one. What has happened to his liver? At the end of this session, you will be able to give the answer. Fatty change is the accumulation of lipid substances in non-fat cells. The main component of lipid is triglycerides. Fatty change is most commonly seen in the liver, since this is the major organ involved in lipid metabolism. But it may also occur in the heart, skeletal muscle, kidney, and other organs. Mild fatty change in the liver may not affect the gross appearance. With increasing accumulation of fat, the organ enlarges and becomes yellow. We know that an organ with edema is also bigger. So, what is the difference? Well, the edematous organ is pale and the organ with fatty change is yellow and greasy. This is a photo of a liver with fatty change. Under light microscope, at the early stage, we can see small lipid vacuoles in the cytoplasm around the nucleus. In later stage, the vacuoles coalesce to form big clear spaces. To some extent, the distribution of the fat deposits varies with the cause. For example, in injuries due to poisons, alcohol, and infections, the fat may be deposited in cells nearest to the effluent blood supply. When caused by vascular congestion, the fat is typically found along the central vein. Under electron microscope, lipid vacuoles allow the bodies encompassed by membrane. Since intercellular accumulation of water or polysaccharides may also produce clear vacuoles, we need to use special staining techniques to distinguish these different types of clear vacuoles. First, we have to prepare frozen tissue sections. These sections may then be stained with Sudan 3 or oil red ore, both of which impart an orange red color to the lipids, and osmic acid stain gives a black color to the lipids. This schematic diagram shows He stain and Sudan 3 stain for fat. The lipids are orange red in color. By using frozen sections, the tissues do not have to be dehydrated through alcohol treatment, and thus the fat does not get washed out. Another common site for fatty change is in the heart. Prolonged moderate hypoxia, as in profound anemia, results in focal intracellular fat deposits in heart muscles. Gross appearance shows apparent bands of yellow myocardium alternating with bands of red blood unaffected heart muscle cells. This produces a striped appearance similar to tiger skin, so-called tiger heart, commonly seen in the papillary muscle. This schematic diagram shows the tiger heart with Sudan 3 stain of non-uniform intracellular fat. If fatty change of heart is produced by more severe hypoxia or by some forms of toxins, we will find more uniformly affected myocytes with diffuse intracellular fat deposits among the yellow myocardium, usually in left and right ventricles. Fatty change of the heart should be distinguished from fatty infiltration, whereby the extracellular connective tissues of the heart is replaced by adipose cells, but the myocardium cells are normal. Fatty infiltration is common in very obese people. This picture shows a fat-infiltrated heart. We can see that the yellow adipose tissue covers the surface of the heart. Histologically, the fat cells are distributed among the normal myocardium cells. Now let's go back to the case. Compared to the dark red color of normal liver, the patient's liver has a yellowish color. The yellow color and greasy appearance suggests fat content in this tissue. Sudan 3 stent was performed on this liver tissue. The cut surface of the liver was orange after being stained with Sudan 3, representing fat in the tissue, which is typical of fatty degeneration can be found. Histologically, we can see clear spaces in the cytoplasm around the nucleus. So, what is the diagnosis for this patient's liver? Considering the clinical manifestation of our alcoholic patient and the growth and histological appearance of his liver, the diagnosis is a fatty change of the liver due to alcohol. Pathological calcification is defined as the abnormal deposition of calcium salts in tissues that are not normally calcified. Essentially, any tissue other than bones or teeth. Calcification is very common in injured or necrotic tissue, which we call dystrophic calcification. In this condition, there is generally no systemic abnormality of calcium metabolism, and the deposits are localized. The other type, metastatic calcification, may occur in normal tissues whenever there is hypercalcemia. The causes of hypercalcemia include hyperparathyroidism and vitamin D intoxication, etc. In both types of calcification, the calcium deposits give tissue a hard texture. Tissue may feel granular or crumble when it is cut. Dystrophic calcification of atherosclerotic plaques, blood vessel walls, and heart valves are especially common. Disseminated calcification may occur widely throughout the body, but principally affects the interstitial tissues. Calcification of soft tissue can often be detected by X-ray. In standard histological preparations, calcium deposits appear as blue granules located around the cell membrane of injured cells or diffusely in necrotic areas. This picture shows the bottom of the atherosclerotic plaque, and we can see the blue calcium deposits. Could you tell which type of calcification it is? Well, it is dystrophic calcification. Calcium deposit can also be identified by a histochemical stain. The effects of pathological calcification depends on its location. For example, calcification of blood vessels makes them less elastic and can contribute to the narrowing of vessel lumen in atherosclerosis. If severe, calcification of the heart valves can cause the valves to be leaky or narrowed. That is all for degeneration. Now let's make a summary. Degeneration is a reversible cell injury with functional decline, and it is used to describe morphology. The changes are abnormal substances accumulation or inappropriate increase of normal substances. They may be stored inside the cells or deposited in extracellular location. Here are the references and acknowledgement. Thank you.